So welcome everyone. Thank you so much for joining us. This is Messaging That Moves with Change Consulting. I'm Nora Dunlap and I pretty much have the same opener every single time, but I'm the program officer for the MAT Access Point project and the center. And I'm just so appreciative that you took the time to join us today. The MAT Access Point project, in case it's unfamiliar, aims to create a network of organizations throughout California to address the opioid crisis by supporting prevention, education, stigma reduction, treatment, and recovery services for people with opioid use disorder and substance use disorder, and especially by increasing access to medication-assisted treatment. So organizations in this funded cohort pretty much do everything under the sun as relates to opioid use disorder, substance use disorder, and MAT. So throughout the project period, we will be offering several technical assistance webinars for partners to access as resources. And this is the second of an exciting 5-part webinar series focused specifically on communications and practical skills to implement a communication strategy. The upcoming topics for these webinars include today's Messaging That Moves, the June 18th Digital Media Basics, and we will send out additional information and e-blasts to register for that one as well. Storytelling for Social Change in July, and then Earned Media Basics in August. So just as a reminder, the entire webinar is being recorded, and the recording and the slides are going to be posted on the MAT Access Point website under the resources page, so you'll be able to access them whenever you need, share them with other staff, or for reference and review. You can always send your questions anytime via the chat box. At the moment, I've made it so participants are unable to mute themselves, but I will confer with Meredith and I can undo that if needed. We're gonna use this Zoom meeting platform kind of for a little bit of interaction in a moment. So it's truly a privilege for the Center and the MAT Access Point project to sponsor this webinar, providing an overview of how to develop the why, what, how of your issue or work in a way that really compels your audience into action. And with that, I would like to again introduce and welcome Meredith Fenton with Change Consulting. She is a strategist, trainer, facilitator, and coach who partners with change-making leaders, organizations, and movements to shape effective strategy, tell powerful stories, facilitate productive conversations, build capacity and skills, and win progressive social change. Some of her partnerships include the Latino Community Foundation, Othering and Belonging Institute, Immigration Legal Resource Center, the GSA Network, Food System 6, Alliance for Boys and Men of Color, Oakland Human Services Department, and Anchors in Resilient Communities. So Meredith, welcome, and I'll turn it over for you. Would you like me to make it so that participants are able to unmute themselves?
Sure, yeah. We have a slightly smaller group, so feel free to give folks that capability. But also, I would welcome folks to maybe stay on mute for most of the session. Just we're living in these unprecedented times. I know that you might have little ones around or older ones around or pets around. And so we get that there may be those both distractions and noises, and so just to keep it accessible to folks, we're going to keep folks on mute most of the time, but please chime in if you have questions. We'll also be using the chat, like Nora said, so that you can share your thoughts, your comments, and your questions along the way. So welcome back for those of you who were able to join us last month, and welcome to those who this is your first of our communication series. I'm really excited today to be representing the team from Change Consulting, and I know I have at least 2 of my colleagues, Anna and Dina, on the line today, and they're going to be helping sort of move the conversation along through the chat and answering questions. So you'll be seeing them engaging a lot. Change Consulting is a communications shop, a small women-owned shop that is based in Oakland, and Change works with nonprofits and foundations and movements all over California and the country to help them use communications as a more effective tool. And we're really excited to be partnering with you all over the course of this series. And Nora, thanks so much for a little bit of that introduction. My name is Meredith. I'm also based in Oakland, and I spent about 15 years of my career in-house at nonprofits, and then have been on the side of being more of a consultant and partner for the last 7 years. And so my work is really about partnering with leaders like you all to use tools like communications and storytelling and messages so that we can create the world we're trying to create. Um, and I would love to have folks chat your introduction so that we can see who's here. Let us know your name, your pronouns, what organization you're here representing. Would love to see where folks are based so that we get a sense of, I know we have folks coming from all over the state. And then if, as you were thinking about attending this session, what's either a question or a challenge that you're facing when it comes to messaging about your work? And we'll do our best to answer as many of those over the course of our conversation today. And with that, I'd love to invite my colleagues Anna and Dina just to do a quick introduction so that you have a sense of the people and the faces behind the people who are going to be chatting at you. So Anna, I'll turn it to you.
Thanks, Meredith. That was a great introduction. My name is Anna Ghosh, and I am on the team of Change Consulting. And I'm really excited to hear. I'm excited to see the chat is really active. People are introducing themselves. Please do that. And also lean on me and my colleague Dina to answer any questions or in the chat. We're here to support you as well. And with that, I will turn it over to Dina to say hello.
Hi, everyone. I apologize I'm not on video. This is Dina Siegel. I'm part of the Change team. I'm really excited to be here with you today. I know that we believe communications is the secret sauce, and we're excited to hear from you about how that can be incorporated into your work. Take any questions, and Meredith has some great examples, case studies, and knowledge to share with you all today. So thanks again for your time.
Awesome. And again, welcome. Thank you all so much for introducing yourself. I see we have folks from up and down the state and west to east, and really glad to be with you all today. So what we're going to accomplish over the next about 50 minutes, we want to start by just grounding us all in why is it so important to think about messaging, and a bit about how message and messaging functions in service of the work that you do for your communities. We're then going to talk through a set of best practices, just some of the top level things to keep in mind as you're starting to think about how to communicate and get the word out or to connect with the audiences you need. We're going to introduce a couple little message tools that are little formulas that can help you construct and think through messages, and hopefully give you a minute or so to be able to play around with them. And then we'll end with some time for questions and discussion to see what's coming up for folks and how we can help folks apply this to the unique situations that you're all working in. And then at the very end, we'll review, I know Nora shouted out some of the upcoming trainings, but we'll just talk a little bit about those in our office hours as a reminder at the end. So why does messaging matter? Really, it's about thinking about all the people that we need to be part of our work, and thinking about how do we connect with them in the places that matter, right? And that a lot of the time we think about, it's just about getting the right information, the right facts, or the right knowledge into people's brains. But actually we know that we make more of our decisions based on our feelings, what's in our hearts. And so thinking about message is really about thinking how to use it to connect with folks, to move their hearts and their brains along so that they're able to take the actions we need them to take, or we have them shift their behaviors or their beliefs in a way that supports the progressive change we're trying to make. It's also important, which is a silly reminder, but that words actually mean things. And that particularly, you know, in our movement, sometimes we use words not even realizing the meaning that we might be conveying. I'm one of the people who I've learned so much around messaging is Anat Shanker Osorio. She does a lot of work with what's called the Race Class Narrative Project, as well as done tons of research on the linguistics and the words behind messaging. And one of the things she said as an example about words meaning things was she was talking about the 2008 and 2009 financial and housing crisis. And she talked about during that time how we would say, you know, millions of Americans lost their houses. And she paused and challenged everyone to think, have you ever actually lost a house? It's like you lose your keys, you lose your phone, but you are not going to lose your house. And actually what happened was that millions of people had their houses taken away from them by banks and other people, right? But just that even putting those words that had those meanings, it shifts what people take away and the things that we may be consciously or subconsciously communicating to people. And so it's really important for us to just remind ourselves, words actually mean things. And so how we use them has a lot of power and a lot of impact. It's also about consistency, particularly, you know, if you think about your internal teams, the folks that are on your bench that you do your work with. Are you all saying the same message about what you're up to in the world? And this is something that I often find. I think back, my last in-house nonprofit job was at the Ella Baker Center for Human Rights. And when I joined that team, there was about 25 folks on staff. And as the director of communications, I went around like in my first month and I asked all 25 people, when you get asked, what is the Ella Baker Center? What is your response? And I got 25 different answers. So we, the staff of this organization, were starting 25 different games of telephone out in the world about what we were and who we stood for. And one of the things we saw was that actually was impacting us. We had different campaigns and different programs, and a lot of folks did not know that all of those things were part of one organization and one center. And that was because of the game of telephone that we were starting. And so message is really important around that consistency, that when you and your team are singing from the same songbook, even as the message gets farther away from the source and it has that game of telephone, at least if you're having this clear and consistent message, you're starting the same game of telephone with the folks that you're working most closely with. It's also important to think about just how human brains work. And the human attention span is actually getting worse. It's probably not shocking to anyone that one of the biggest culprits for why that is are these little things, our little phones, right? We're just so used to mass amounts of information and messages. There's noise around us all the time, and we're used to going through it really quickly. And so we actually just don't have a great attention span, less than a goldfish, right? Who are notorious for not having a memory. And so if we have a very short moment to capture people's attention or get them to care or get them to listen to us, we have to be really thoughtful about our messages because we only have a few seconds to pull people in. Particularly as advocates, those of us that work in these movements, we often are trying to talk to people who are far outside of our movements. They've never worked in organizations. They've never thought about social change necessarily. And so a lot of what is happening is that we are speaking our language or our jargon, and it's like we're on the top of a mountain and we're yelling across a void, trying and hoping people will hear us. But what those people on the other side of the mountain are hearing sounds like Italian. And so then they start yelling back, I don't understand. But like then on the other way, it sounds like they're yelling back in Russian. And it's just like we're yelling each over a chasm. And so often we're just missing the chance to connect to those audiences because we're not speaking their language. On top of that, our audiences often feel like they are in a game of tug of war between us and whoever the opposition is, right? So folks who are not supportive of our efforts or who are trying to move things in a different direction. And while we know that maybe where we're coming from has like morals and facts on our side, to the audience, we just seem like another scary clown that's pulling them in different directions, because the polarization that people feel in our country in this moment actually floods them, and it makes their brains freak out, and they just can shut out both sides, even if they were likely to maybe agree with us, because they just feel like they're being torn back and forth, tug of war. So just a quick case study, and this comes from some work that my colleagues at Wonder Strategies for Good and Goodwin Simon Strategic Research put together, that's called Heartwired, which is really about how to do research that can inform your messaging and think about the ways that messaging can move us towards the world we want. And so here you'll see on the left, the idea of physician-assisted suicide. And I don't know if folks remember what that is, but it's the idea that if you're terminally ill, that you may want help sort of ending your life. And for many years, movements called it physician-assisted suicide. But I'm curious, you know, feel free to either weigh in or chat, like, what does that evoke for you? When you hear those terms, what kinds of images or feelings come up for folks? Does it sound scary? Does it sound hopeful? Does it feel like something you want grandma to have access to? It's a personal choice, okay? So it sounds like it's something about personal choice. What else? Compassion. That it should be a patient option. So one of the things I am now realizing is that because you all are very immersed in health, this is not landing for you the way it lands for most audiences, because you know what it means. For most audiences, 10 years ago, when the movement to secure this compassionate patient option for folks, and they were using the word physician-assisted suicide, it freaked people out. And over again, state-level advocacy to try to win this right for patients was losing. And part of what was happening was the actual words were evoking for images that it was the physician who was in control. That it was kind of like what they would imagine was just a cliff with thousands of seniors and sick people just going over the side like lemmings, with physicians just helping them along the way. And so for many years, it was very hard to get traction, right? But then after some research and thinking about it, they shifted. It's the same thing, but they came up with the idea of medical aid in dying. And I'm curious, like, how does that land? What emotions or feelings or thoughts does that bring up for folks when you compare it to how it might be to physician-assisted suicide? I'm seeing someone say medical apartheid. It comes up for them. It sounds more compassionate, right? It's patient-centered, right? I think patient-centered is very key here. I also really appreciate who observed that it's the suicide piece that mucks it up, right? And that is so correct. Suicide means things to people, right? It doesn't have a happy connotation. It has a sad and traumatic connotation. But when we move it to the idea of medical aid in dying, both, it makes it clear that we're talking about folks who are dying. We are all dying, right? But for folks who for that is really closer. It put the control back in the patient. It sort of moved some of those fears about fate control, the idea that people's hands are their lives are in the hands of doctors, and puts it back in the hands of folks. And so, and I do see, I really appreciate this, the idea that, like, the idea of how folks experience different things in the medical industrial complex. Thank you, Lakia, for bringing that up. And for certain, there are different communities that ideas of medical aid in dying or physician-assisted suicide would land differently. My colleagues that I mentioned earlier who did the Heartwired work, they did a ton of research, particularly in Black and Latino communities, and they found that for those communities, medical aid in dying evokes something so much more positive and hopeful than physician-assisted treatment-assisted suicide because of the long legacies of ways that people of color have experienced a lack of control and agency in healthcare, right? And so while this is a case study we could probably spend all day on, looking at the language and the words and how it moved, I really just wanted to bring it to sort of show you with a simple example of how just even the difference between 3 words and then 3 different words can help folks make progress. And in this case study, they've been able to win the right for patients to be in control of their end of life decisions in several states. We've made a lot more progress in recent years. So what does that all mean, right, when we think about messaging? The #1 rule is that we often just start with like, well, what do I want to say? What do I want people to know? And the thing and the muscle that we need to build is that it's not about us, right? It's about what our audience needs and about the audiences we need to get into the work. It's about how do we meet the needs of our audience so that they understand what we might be offering them, or they might decide to try to access treatment, or they might think differently about advocating for their loved one who is struggling with addiction, right? And a lot of that, again, as a reminder, is about evoking their feelings. It's not about what is in their head. It's not just that if they just had the facts, they would do things differently. It's that feeling, the thing that they'll remember, that will compel them to action, whatever that action is. One of the ways we do that is by starting with the why. You all are amazing leaders on these issues every day. And so you probably take a little bit of the why for granted because you are mired in the day-to-day of what you do and how you do it. But for the audiences that are not as familiar with our work or not as knowledgeable about the things that you're knowledgeable about, they can't get excited about the what and the how until they understand the why. And so you'll hear a lot of communication folks saying all the time, you need to start with the why. You need to start with the why. Whether you're trying to raise money, whether you're trying to change laws, whether you're trying to recruit folks to sign up for a program, when you start with the why, you're bringing them in a way that is going to be more compelling and connect to their hearts than if you start from the how or the what. You also want to think about the idea of messages being sticky. And what we mean by that is something you can remember, right? Sometimes folks have slogans and the slogan is like 11 or 10 or 15 words long. It just can't stick in people's brains. And you want something that can be repeated over and over again. The idea is not to have a new way of talking about your work or your organization every time you talk about it. Because the thing is our audiences, it takes them several times of hearing things to remember it. I've seen conflicting research. Some says it takes people hearing something 3 times before they remember it, but I've seen other research that says it may be as much as 7 times. So just about the time that you feel like a broken record trying to say the same thing over and over again, it may be the moment when your audience is just starting to remember it, right? And so these are all just, again, examples of really simple, easy to repeat and sticky statements that organizations and companies and movements have used as examples of how do we break through. I often invite folks to think about the people that you want to bring into your work. Think of them as a funnel, right? A funnel is wider at the top, but a lot of times in social change, we are talking to the people who are already with us. And so I like to think about how do we bring the next group of people in, those who are maybe adjacent to the people we already have. How can we actually give them ways into the work if they're not already there with us? And one of the ways to do that is by making some hard choices and having to focus. A lot of times folks, when they're struggling to figure out how to get the word out or sort of tell the story of their organization, they'll tell me that they feel like they just don't have a way of explaining everything they do and everything they stand for. The good news is, well, I would say the bad news is nobody wants to know everything you do and everything you stand for. It's too much information. Think about a time that when we used to get to go out and meet people, where you met someone new and you asked them what they did for work. 15 minutes later, if they're still talking and talking and talking, you're starting to look for like your exit strategy, because it's just too much information, right? And so we really want to focus on, for the people we're trying to connect, what part of the story do they need to know for them to then take the next step towards action or getting involved or shifting their behavior? One of the ways we make sure we do that too is by translating jargon. We speak so much jargon in our movements and organizations that we don't even realize that it's jargon anymore. I always even forget that the word nonprofit is jargon. My mother-in-law, and I've been in my relationship for 13 years, so it's not like she just met me. I found out 2 weeks ago, she thought that because I worked with nonprofits, that my clients didn't pay me and that they didn't have any money. And my mother-in-law is not in our core audience of like progressive community folks, I will say that, but I was still shocked. I just couldn't believe that she had no sense of what a nonprofit means. But it was a great reminder that a lot of people don't, because they don't have the benefit of all the years of experience that you have. And so it's really about looking at almost anything you write that you're going to put out in the world, whether it's verbally or written, and figure out, how am I going to translate this to make sure that it's accessible to the people I need. Another thing to think about is, how can you connect with your audience based on something you both care about? A lot of times people will say, you got to meet your audience where they're at. And folks will say back to communications folks like me, where my audience is at kind of stinks. We don't share anything with them, but we need to move them. I am not suggesting that you leave all the things that you care about behind. I'm suggesting that you look for where, even if it's just a sliver, do you and your audience overlap in something that you believe or something that you care about that can bring them in. And when you lead there, you're sort of hooking them in, because you're meeting them in a thing that matters to them already, rather than trying to convince them that something they believe is wrong, or convince them that something you care about should be the thing they care about as well. You also want to get really clear, what are you asking them to do? What is it you need them to do? Don't just leave it for them to make meaning, but actually make an ask. And in general, you want to try to make one ask at a time. Sometimes it can feel more comfortable, particularly in fundraising, to say, well, we can ask folks to give, but we could also ask them to volunteer, or we could ask them to do this and this and this and this. When folks are given lots of options, often they will opt out because they become overwhelmed. It's the paradox of choice. Whereas if you ask them one thing, can you make an appointment at this clinic? Can you give us $25 to invest in our mission? You kind of have a 50-50 shot, right? Because it's a yes-no question. And so you want to get clear, like, what are you building towards in your ask? And then try to make one at a time. We also really need to show people rather than tell them, right? And that they don't get to stand in your shoes and see what you see every day. So we need to paint a picture of it so that they can understand it and that they can imagine it. And we're doing a future session on storytelling because this is such a big piece, and that stories are a really big way that you can show versus tell. But even in your messaging, if it's not a story, there are ways that you can use it to, rather than say, we are experts with this experience, you can show people that by the way that you communicate about the topic that you're an expert on. Here's just an example from an organization I used to work at way back in the day. And Collage is a national organization of young people who have one or more lesbian, gay, bisexual, transgender, or queer parent. And it's a youth leadership and youth advocacy organization. And on the left, you can see just the way we would sort of, our elevator pitch, which sounds like a nonprofit mission statement because it is. And it's a little jargony, and it's like, okay, what does that all mean? Whereas on the right, from this first person message from Namir, He is saying all the elements of that mission statement, but by showing it, right, through his lived experience, rather than just telling people that these are the things that collage does. One of the sort of things is, as you're writing and you read, ask yourself, does it actually give people an image, right? When we talk about civic engagement, a lot of everyday folks, your neighbors, they don't know what you mean. But if you talk about it as neighbors going door to door to get the word out about an important election, or everyday neighbors coming together to try to solve problems, you can actually picture that. You can actually see the little movie in your head of what it looks like. And so one way to do, again, that sort of translating of jargon and trying to make your funnel wider is to make sure that you're painting the picture, you're showing people versus telling them. You also want to think about how you might convey the urgency of what you're up to. Through work that I do with the Latino Community Foundation's Accelerator, I got to sit in on a presentation from somebody who does brand work in Silicon Valley. So most of the time he's working with startups and tech companies for them to try to tell their story. But he was doing a presentation for Latino-led organizations from around California. And he was talking about how if you look at the branding and the messaging that comes out of every tech company, they talk about what they're doing like it is the most critical, most important, most urgent thing in the world. And yet, they're probably doing something like making sure people can get their dog food delivered. To me, that is not necessarily the most critical issue of our time. And then when we look at the way that a lot of nonprofit organizations talk about our work, we talk about it as it's a nice to have. When the work that you are doing is saving lives, it's not a nice to have, it's a need to have. And so one of the lenses that Juan Carlos introduced me to is to look at, are you talking about yourself in a way that makes it seem like you're a vitamin, which is a nice to have thing that will probably make your community or your body better, but it's not horrible if you don't have it? Or are you a painkiller? Right? Is it you are urgently in pain and we need this solution to stop the pain? And you want to try and talk about your work with an urgency so that you are a painkiller, that you're a need to have, not a nice to have. And even as we do that though, we want to make sure that with the urgency, we're not fueling polarization. We're not coming into a place that makes people in the middle feel like they're in that tug of war between different opposing sides where they just opt out of it all. We need to really help them move through the feelings that come up because polarization does not feel good. And we also, one of the ways that we can get into that polarization is when we get into a he said or a she said, right? And we try to convince people that we're right by saying that someone else is wrong. But the thing that happens when we repeat opposition frames is that more times than not, what they remember is the opposition frame, not our rebuttal to it, right? And so here's just a good example I pulled from a handbook that I'm relying on a lot, which is about, particularly in this moment, the moment of Trump, how do we message in ways that are progressive? And they had this really good idea of like, okay, these are the things to embrace so that we are replacing frames that have us repeating what our opposition wants people to think and feel and remember. And then lastly, as much as it's important to think about the message, you also want to think about your messenger. And here are just 3 different people. They're basically saying the same thing. But it feels a little bit different for each of us because we all have different either responses or relationships to Greta or to Neil or to Leo, right? Things land differently even when we're basically saying the same things based on who's saying them. And so sometimes you may not be the right messenger. Sometimes when we're thinking about folks who need to consider, treatment options, maybe they need to hear from someone else who has considered that treatment option or has been on a journey. They need someone that they can relate to. And so thinking about those messengers is also really important. So I know I just went through a lot of best practices. And so I wanted to introduce 2 tools that might help you pull together different elements of these best practices. And so one is the idea of a core narrative, or, different folks will call something like this all sorts of different things, but it's sort of like your communication sandwich. And you start from a place of making a statement that meets your audience's needs. That is the kind of thing that it would be very difficult for almost anyone to disagree with. Because what it does is it starts your message cueing people to agree. And once their brain is like, whether physically nodding or like on the inside nodding, you're priming your brain to agree with what comes next. Then you introduce the problem. What is wrong with the world that we need to fix? And what can we do about it? Here's where your organization or your program or your bill can be the solution. And then at the end, we talk about, well, why will it matter? If we do the thing we're inviting folks to do and we take the action we're asking people to take, why will it matter? What is the vision of what it will add up to? And it's a sandwich because it begins and ends with, again, things that are going to meet your audience's needs and often be things that match their worldview. And then the problem and solution, which may be the harder part for them to digest, is in the middle, right? And that's the meat of the sandwich, or the meat, non-meat plant alternative. If I have any vegans. So here's a few examples from different organizations and campaigns. So this organization, First Place for Youth, is one I talked about in our first session, in terms of how they really realized that they needed to start talking about their work in a way that more met the needs and the information that their audience had. And this was particularly in terms of they were trying to talk to donors who were going to give them money for their work. And First Place for Youth works with young people who are coming out of the foster care system from the time they're 18 until they're 24 in that transition. And so they start with something that is hard to disagree with, which is that family really matters, right? And that will start evoking people this sense of, like, if they had a family that had really helped them, they have happy memories there. If they felt like their family didn't give them caring support, they can understand why that was hard. And so then the problem around foster kids is sort of messaged in a way that it's a problem standing in the way of family, right? It's contextualizing the challenge through this entry point of family. And so then they can talk about first place in a way that addresses this issue, again, through that lens of family. And then in the end, they talk about why it will matter. That really what they're about is that they support young people along the way as they learn to support themselves. So this is a different example because it's from a campaign, not an organization. And it's hot off the presses. I think Heal Safely was just launched last week. And it is a campaign to help folks consider different kinds of painkillers if they are recovering from surgery, as a way to do preventative work around opioids. And the Heal Safely, we'll chat you this link. They have a bunch of research that they did where they really learned a lot of the gaps and myths within their audience's understanding. One of which was that a lot of people, they know that opioids are a drug, but they don't actually know what kind of drug opioids are. And so you'll see here, they talk about opioid painkillers because they needed to make sure people knew what they were talking about. And again, so this, what do we believe in? It may not be like family of like, this value on a pedestal, but it's this belief that most people would agree with, that pain is part of life and pain is something that we want to manage, right? And so with that as the entry point, they open themselves to this conversation to folks who are thinking about what it means to be able to heal if they have been experiencing pain. And then just one more example, this was for 17 organizations around the country did a lot of research around the costs of incarceration on family members of those who are incarcerated. But they also did a lot of other research, and they needed a way to pull it all together. And so they pulled it under this idea of who pays. What are the true costs of incarceration? And again, the entry point was family, right? But so you can see how, these values, these common values are often similar, but they're different entry points for different conversations. And here, family as the value was used as an entry point to talk about how incarceration is a way where we are actually removing people from their families, and that creates a lot of costs that a lot of people haven't really thought about, right? So then they can introduce their policy ideas as like just at the top level as the answer, and can bring people into this conversation. So then the other tool that I wanted to introduce, which is more for the core narrative formula, is a great way if you're trying to talk about a program or an organization, or if you're just trying to structure the elements to talk about something. This is if you personally have to prepare to deliver some messages, the message triangle might help you sort of, again, touch on some of these different best practices. So one is that's where you talk about, why are you talking? You share a little bit about yourself so that people can relate to you, and that it doesn't seem like you're talking because you're trying to polarize people, but you're talking maybe because you're someone who's worked in healthcare for a long time and you really care about the health and access for each of your patients, right? That gives you that credibility for why you're talking on the issue. And then you'll say something about what you believe. And that is, again, the place where you're going to appeal to your beliefs that match what your audience also believes. And then you can end with therefore. What is it that you stand for? What is it that you're inviting people to do? So therefore, are you inviting folks to come check out the clinic? Or therefore, are you asking folks to vote yes or no on a bill? Or therefore, are you asking folks to consider giving you money or becoming a volunteer, whatever those things are? And so just an example that I created, this isn't from my campaign, right? This is how it might look, right? So and so again, for those of you, because you're working in health, it may be something about what brought you into health or the community that you've worked in. The I believe, you're gonna make that statement about what it is that the frame and the funnel through which you want folks to consider your call to action. And then the therefore is where you talk about what it is that you are asking for or calling folks to do. So I just talked a lot, and so now I want it to be your turn. I just want to give folks a little bit of time to play around with either one of these. I invite you to think about whether it's your organization as a whole, maybe a fundraising campaign that you need to launch, maybe a flyer that you've been sitting on and you need to create for a new program. How might you adapt some of these best practices and use these message tools? So we're just gonna give folks about, like 5 or 6 minutes, play around with it. And then we'll end by seeing how it went and seeing what questions and reactions folks have to trying to use the tools. And don't feel like you need to have a perfect message at this point, even just bullet points, right? Or drawings if you're a doodler. Just see how it feels to try to fill in some of these formulas, talking about something that you need to talk about. So great, I'm gonna give you a few minutes to do that. So just a couple more minutes. I know that it's not a ton of time, but we just wanted to give you a minute to try it on. So a couple more minutes. Okay, great. Well, I'm wondering if is there anyone who'd be willing to either share their message, or did anyone find any stumbling blocks or questions when they started to think about how they might use these tools for your work? What's coming up for folks? And feel free to either unmute yourself or you could chat any questions or ideas. We'd love to know, how did it go? I know it wasn't a ton of time, but which tool did you pick, and what came up for you as you thought about using it? Oh, awesome, Janelle. I love this. As a family health center, we believe that each person needs care for spiritual, physical, and mental health. Therefore, schedule a telehealth appointment today. Great. Yeah, and I see your comment that you're not sure if there's the best connection, right? Often I would use a tool like this to do exactly what you just did, right? Like, what are the points I need? And then you can take a tiny step back and figure out now, like, what connective tissue might it need for it to flow as sort of a message that holds together. But that was a great start. Awesome work. Are there others who either have questions or might be willing to share the start of a message that they played around with? I'm glad to hear that. I'm seeing Libby saying it was a quicker, better constructed message, right? I appreciate you saying that. I think one of the things that happens is, like, we think like we have a hard time not being verbose, because again, we want to tell the whole story and we feel like we need to tell them everything they need to know, right? And so one of the things to do as you think about messaging is be a bit of a messaging sleuth. What catches your attention? You probably get 7 million emails a day. Which ones do you actually open? Particularly ones that are coming from groups that aren't like, Dear Meredith, open me up, right? Like, what catches your attention? What makes you feel something? Start looking at those things like a sleuth, and start asking yourself, how do you then take those things you're seeing and that are working for you into the messages that you're creating for other audiences? Great. We have a few more minutes for questions if folks have them, either if they're, you know, there's ideas or things where you're like, I think I understand some of these best practices but yeah, what's coming up? Oh, Anna, I love that. Do you want to say more about that? I think that's so important.
Well, Meredith, I think you addressed this when we talked about the repetition and the broken record. And just a reminder that once you do find a message that seems to really work with your audiences, repurpose, recycle, reuse. Because even though you might be tired of saying it, chances are it'll still be fresh and new. And again, like the more we hear something, the more it'll stick.
Awesome. Great. Other questions? Keep thinking if you have any, and while you noodle on that, just again a preview. This session was recorded, and we'll be sharing the slides. So feel free to go back and review it. If you want to share it with a colleague, if you want to, you know, do a Zoom watch party so that you can be thinking with some of your teammates about how to apply this, feel free. We hope that these tools are yours to use, and we hope they will be helpful. We also have some sessions coming up. On June 15th, we're going to be talking about digital strategy. We know a lot of folks are thinking about how to translate things online and how to be smarter in this time when online matters more. And so we'll be talking about some of the basics of getting online through social media and other digital platforms. On June 25th, we'll be hosting our second office hours session. Some of you, I think, joined us for our first office hours, which was a few weeks back. And this is just a drop-in session where you can come, and Anna and myself and Dina and Billin will be there so that we can troubleshoot any questions that are coming up for you. Or at our last office hours, one of the teams, 3 folks from a team came because they had a video project that they wanted to test with one of us. Like, we are here to be thought partners and coaches in whatever way is useful. And so please drop in for as much or as little of the office hours as you're able.
Hey, Meredith.
Yeah.
I'm sorry to interrupt. Can I just say something about the office hours? So
Please.
A couple of you have asked really important questions in the chat, particularly around how do we engage rural audiences and audiences that are maybe more dispersed. And then the question about that Priority Care Center asked about, you know, has anyone found a message that works well with MAT outreach to patients? So I think these 2 themes could be a focus for our office hours. And as Meredith said, it's a drop-in to get real-time support. But it sounds like these are some of the questions that probably many of you are holding. So we can use that as a way to really learn from each other and just help the whole movement get stronger.
Awesome, thank you. Cool, and then, so July, like I said, we're gonna talk about storytelling, which is one of my favorite things to dork out on. And then in August, we'll have a final office hours, and we'll also be doing a session on earned media and media relations. So with that, like, we're still here. If folks have questions, I would love if anyone does have an idea to Priority Care Center's question, like if there is a message you found has been really sticky with your patients, feel free to share it. And as I know folks will start to get ready for their next meetings or their lunch breaks, I just want to say thank you for spending your time with us today. And we really look forward to continuing this. Please get in touch if you have questions, and we hope that we'll get to see you in our future sessions. But thank you for the work that you're doing every day, even in these unprecedentedly difficult times. I really appreciate it. And yeah, thanks for your work and thanks for your time today.
Thank you, Meredith. What a fabulous wrap up. I will stop the recording, but I can leave the Zoom on for 5 more minutes in case something comes up. Does that work? Okay, perfect. Thank you, everyone.